What is anorexia nervosa? Anorexia nervosa is a serious eating disorder characterized by an intense fear of gaining weight or becoming fat, leading to extreme food restriction, excessive exercise, and other weight control behaviors. People with anorexia nervosa typically have a distorted body image and see themselves as overweight even when they are significantly underweight. Anorexia nervosa can cause severe physical and mental health problems, including malnutrition, electrolyte imbalances, menstrual irregularities, bone loss, organ damage, depression, and anxiety. It can also lead to social isolation, relationship problems, and difficulties with school or work. Anorexia nervosa can affect anyone, regardless of age, gender, race, or socioeconomic status. However, it is more commonly diagnosed in females than males, and it often develops during adolescence or early adulthood. Factors that may increase the risk of developing anorexia nervosa include genetics. Anorexia nervosa appears to run in families, and there may be genetic factors that contribute to the disorder. Environment. Cultural and social pressures to be thin, as well as family dynamics, can influence the development of anorexia nervosa. Personality traits. People with anorexia nervosa often have perfectionistic, anxious, and obsessive-compulsive personality traits. Mental health conditions. Anorexia nervosa is often associated with other mental health conditions, such as anxiety disorders, depression, and obsessive-compulsive disorder. It is important to note that while these factors may increase the risk of developing anorexia nervosa, they do not guarantee that someone will develop the disorder. The development of anorexia nervosa is complex and can be influenced by a variety of biological, psychological, and environmental factors. What are the symptoms of anorexia? The symptoms of anorexia nervosa can vary in severity and may be different for each person, but typically include 1. Significant weight loss. The most noticeable symptom of anorexia nervosa is a significant, intentional weight loss. The person may be severely underweight but still perceive themselves as overweight. 2. Obsessive preoccupation with food, calories, and dieting. People with anorexia nervosa often have an intense fear of gaining weight and will go to great lengths to avoid food, including avoiding social situations that involve food and obsessively counting calories. 3. Distorted body image. People with anorexia nervosa often have a distorted body image and see themselves as overweight even when they are significantly underweight. 4. Restrictive eating habits. People with anorexia nervosa may limit the types and amounts of food they eat, skip meals, or avoid certain foods altogether. They may also engage in rituals around food, such as cutting food into tiny pieces or arranging food on a plate in a certain way. 5. Excessive exercise. People with anorexia nervosa often engage in excessive exercise as a way to control their weight and burn calories. 6. Withdrawal from social activities. People with anorexia nervosa may avoid social activities that involve food or eating, or they may become socially isolated. 7. Physical symptoms. Anorexia nervosa can cause a variety of physical symptoms, including fatigue, weakness, dizziness, fainting, and hair loss. Women with anorexia nervosa may also experience irregular periods or a loss of menstruation altogether. It's important to note that not everyone with anorexia nervosa will exhibit all of these symptoms, and the symptoms may vary in severity. Untreated, anorexia nervosa can lead to a variety of serious health complications, including depression and anxiety, malnutrition, electrolyte imbalances, osteoporosis, anemia, amenorrhea, and suicide. How is anorexia diagnosed? Anorexia nervosa is typically diagnosed by a healthcare professional, such as a psychiatrist, psychologist, or primary care physician, using a combination of methods, including physical exam. A physical exam may be performed to check for signs of malnutrition and other physical complications of anorexia nervosa. Psychological evaluation. A psychological evaluation may be conducted to assess the individual's mental health, including their thoughts, feelings, and behaviors related to food, weight, and body image. Diagnostic criteria. The healthcare professional may use the criteria for anorexia nervosa listed in the Diagnostic and Statistical Manual of Mental Disorders to help make a diagnosis. Blood tests. Blood tests may be performed to check for electrolyte imbalances, anemia, and other health complications related to anorexia nervosa. Eating disorder assessment tools. There are several assessment tools available that can help healthcare professionals diagnose anorexia nervosa and other eating disorders, such as the Eating Disorder Examination and the SCOFF questionnaire. Anorexia nervosa can be difficult to diagnose, especially in the early stages when the person may not exhibit all of the typical symptoms. It's important to seek professional help if you or someone you know is experiencing symptoms of anorexia nervosa, even if a diagnosis is not immediately clear. What is the treatment for anorexia? The treatment for anorexia nervosa typically involves a combination of medical, nutritional, and psychological interventions. Treatment may take place in an outpatient setting or a residential treatment program, depending on the severity of the disorder. Treatment for anorexia include 1. Medical treatment. Medical treatment may involve hospitalization if the person is severely malnourished or has serious medical complications. Treatment may include rehydration, nutritional support, and management of any physical complications. 2. Nutritional therapy. Nutritional therapy may involve working with a registered dietitian to develop a meal plan that promotes weight restoration and proper nutrition. The meal plan may be adjusted over time as the person progresses in treatment. 3. Psychotherapy. Psychotherapy, such as cognitive behavioral therapy and family-based therapy, may be used to help the person address the psychological factors that contribute to anorexia nervosa, including distorted body image and negative thoughts about food and eating. Group therapy and support groups may also be beneficial. 4. Medications. Medications, such as antidepressants or antipsychotics, may be prescribed to help manage co-occurring mental health conditions, such as depression or anxiety. 5. Hospitalization. In severe cases of anorexia nervosa where the person is at risk of serious medical complications, hospitalization may be necessary to provide 24-hour medical care and support. Treatment for anorexia nervosa can be challenging and may take time. Recovery is possible, but it requires a long-term commitment to treatment and ongoing support. If you suspect that you or someone you know has anorexia or another eating disorder, seek help immediately. Eating disorders can become increasingly dangerous the longer they go untreated. In severe cases, the effects on the body caused by eating disorders can be fatal.